The Minnesota Department of Health has completed a study looking into why Minnesota nurses leave direct hospital care positions after hearing concerns from the healthcare providers about staffing.
Evan Berg checked in with a local hospital and the study author to hear more about their findings.
I don't think that bedside nursing is a profession in decline.
Despite many hospitals claiming bedside nursing is in decline, Terry Fritzma says the state of Minnesota has found that nurses in the profession are actually on the rise, with 121,000 active RN licenses being estimated just 2 years ago.
Some of the perception just comes from some of the very first reports that were coming out of COVID.
Fritzma says during her study, she found that many nurses were reporting feeling overwhelmed. During the course of her 2025 study, 14% of the 55,000 nurses surveyed reported dissatisfaction with their job.
Right. It's kind of this confluence of factors.
She says those reporting dissatisfaction and burnout reported a number of reasons: issues with management, lack of training, and workplace violence from patients and families.
Where you have, on the one hand, a younger workforce, and on the other hand was just simply patients are getting, not just sicker, not just more, the term is, more acute in terms of the care that they need, but also just more complicated.
The CEO of Rivers Edge Hospital says she's unsurprised to hear about those trends.
I think one of the things that all hospitals struggle with is, trying to balance the patient acuity and the nursing need for that with the staffing constraints.
She says her hospital has 80 nurses, with many of them being on the younger side after the COVID-19 pandemic.
One of the things that we know that we need to pay attention to is just how we onboard our staff.
She says a big part of preventing burnout is providing peer mentorship early on and monthly feedback meetings where nurses' contributions are recognized and their concerns can be heard.
We have seen some of our patients coming in sicker, and then we all know that insurance drives their discharge quicker. And so that's been a shift regardless.
In St. Peter, Evan Berg, KEYC News Now.
The MDH concluded that it suggested next steps for healthcare providers to take steps to avoid burnout by providing clear and supporting communication, better managing workloads, and implementing reliable policies against physical and emotional abuse.